In your experience and from what you've seen, how is the VA's track record on addressing PTSD?
Pretty abysmal because of the wait times. But the Veterans Access Act, it's a really critical piece of legislation that solidifies these community care options for veterans, but also has a really important pilot program covering substance abuse and mental health.
Mm,
The critical thing, or the big disconnect when you're handling PTSD, it's the same as any other form of mental health issue or substance abuse issue, which is very personal for the veteran, for any person. And when somebody reaches that window where they're ready to get help, especially if it's a long running issue, and you have a lot of post 9/11 veterans that deal with this stuff, that window where they're willing to get help could be a day, could be a weekend, right? Could be after an intervention. Well, if you're using the VA, sometimes you'll go ask for help and they'll say, well, we can see you in 28 days or we can see you in
wow.
2 months. Well, that veteran might be dead by then,
Yes.
right? And we've seen for the past 10 years that I've been working on veterans issues, it's heartbreaking whenever you hear about a veteran who takes their life in the parking lot of a VA facility. So what this legislation does, the Veterans Access Act, it'll make sure that whether you're going to a VA facility or an urgent care or wherever, CVS Health for all I care, wherever you can start your journey to get better, VA is going to be there and cover that. I think that's going to save a lot of lives, and I also think you're going to find that being able to go down the street and get care that's close to you is probably not going to be as expensive long run as all of these wait times, funding all this bureaucracy and overhead. At the end of the day, again, spend the dollars. Just get the dollars to patient outcomes, to veteran outcomes as fast as you can.